Hello and welcome, everyone. Welcome to NCAP's webinar, The Changing Landscape of Adoption, New Insight and Big Implications. I'm happy to introduce our two presenters today. Jesus Palacios is a professor of development and educational psychology at the University of Seville in Spain. Primary focus of his research and practice activities is child protection, particularly in adoption and foster care. Among his scholarly work is a longitudinal study on the impact of early adversity and post-adoption recovery. He also participates in international research networks, including by organizing the fourth International Conference on Adoption Research in Spain in 2013. A prolific writer, Jesus has published numerous research articles and books on adoption and foster care. On the practical side, he has developed professional instruments for the assessment of suitability and preparation of both adoptive and foster parents. He collaborates in the design of child protection policies in various countries. He participates in research projects and practice networks to improve our understanding of individuals and families, as well as professional interventions to support them. I'd also like to introduce David Brodzinsky. He is a member of the NCAP team and is the co-author of, most recently, The Adopted Child with Jesus Palacios. David, who is the Professor Emeritus of Clinical and Developmental Psychology at Rutgers University, worked with the Donaldson Adoption Institute for 18 years, first as a board member and later as a research and project director. Over the past 4 decades, his research and scholarly writings have focused primarily on issues related to the adjustment of adopted and foster children and their families. He has published more than 100 professional journal articles and book chapters related to adoption and foster care, as well as 7 books on adoption. He is internationally known for his research on developmental and family issues in adoption. David lives in the Los Angeles area where he maintains a clinical and consultation practice focusing on the mental health needs of adoptive kinship members. He is also a consultant to the Center for Adoption Support and Education and has been a training consultant to numerous public and private adoption agencies throughout North America and Europe. My name is Allison Davis Maxon. I'm the executive director at NCAP. And right now I'm happy to introduce our facilitator and moderator for the day, Adam Pertman, who is the president of NCAP.
Thank you so much for taking the time to be with us today. This is going to be a good one. You really have two of the leading thinkers and researchers in the field talking at you today on the occasion of their new book, on the publication of their new book. The format, we're going to try to hold to 1 hour, as promised to everybody, respectful of your time. And the format is you're not going to get talked at with a PowerPoint. This is going to be in Q&A form straight through. I'm going to act as moderator asking the questions, and Jesus and David will obviously be the responders. I want to invite everybody. Allison is going to monitor the chat. Please, if you have questions, enter them as you think of them. This is not necessarily going to be one of those things where at the end we'll leave 5 minutes and see how many questions we can cram in. Since this is going to be a Q&A format all through, please feel free to put in your own questions or comments as you think of them. And Allison's going to monitor it, and as appropriate, we'll pop them in between the questions that I'm asking, and hopefully we'll have a more participatory session that way. So with that, I'll start, and just one last word. Jesus and David, in addition to being, old white guys like me, are old friends, and I respect them enormously and value all the work that they have done over the years, and am delighted and grateful that they're here with us today. So thanks, guys. So right to your book. A lot of attention today, and rightfully so, is being given to adult adoptees. It's a generation coming of age, taking over organizations, changing focus. So within that context, what motivated the two of you, either or both of you answer, to write a book focused on children, on the children in adoption? Why that topic right now?
Well, I'll start with answering. I was approached by a well-known developmental psychologist, Mark Bornstein, who is the series editor for something called The Elements in Child Development, which is published by Cambridge University Press. And he asked us, would we be interested in submitting a book? They're really monographs, but they're published independently as books, small books, on the adopted child. And he wanted the focus to remain on children's development because the series focuses on children's development. So in many ways, we were restricted to only working or organizing our writings around the issues of children's adjustment and factors related to that, and not really going into issues dealing with adult development. And, it was another opportunity to work with Jesus. We always look for projects to write together. We've written a number of things together. We've edited other books together. And so that was really the motivation to start this project. And it was the explanation really to keep it focused only on children's development.
Well, that's pretty straightforward. So given the diversity of the audience we have here, and it is really, really diverse, not in terms of professional and background and associations, what are some of the key takeaways? You focused on adopted children and their families. Are there some takeaways, and keeping in mind people are listening to you from so many different perspectives? What are the big ticket takeaways that you got from putting together, researching and writing this book? And while you do that, fold in some of the challenges you encountered in writing it and in doing that research and presentation.
Well, I may respond to that. The second challenge we had, besides focusing only on children, was a very strict word limit. So we started writing, and after a few weeks, we realized that we were well beyond the word limit. So we had to go back and start reducing the length, and sometimes reducing the focus as well. So some of the topics we wanted to cover were not covered, or were covered only in a more limited way. And the other challenge was how to tell our story to a very varied group of readers, including researchers, policymakers, parents, adoptees,
Right.
etc., adoption professionals. So if I were to choose key message for all of them, I would say that we tend to think of adoption as a child placement option. And it is a child placement option, of course. But I think that the key thing is that adoption is not mainly about placing children. It's mainly about creating the circumstances that promote a better recovery for children after early adversity, and also promote well-being for the individual and for the family. I think that's the key issue: promoting recovery, promoting well-being. And then each one, researchers, policymakers, adoption professionals, adoptive parents, will find their own way to contribute to that main goal. It's not mainly about placing people. It's about creating circumstances for a better life for them.
Well, I would also add that one of the key takeaways, of course, is the rapid growth of knowledge, the rapid growth of people's interest in studying adopted children and foster children, not just for understanding their unique development, but what the study of adoption contributes to understanding children's development. In fact, one of the things that Jesus and I did in organizing this book was to try to organize it around what are some of the key questions in developmental psychology that developmental researchers have been interested in historically, like gene environment, contributions to development, and how does adoption research contribute to that? So throughout the book, we address a variety of key developmental questions and then look at, okay, we have a lot of research in this area, whether it be about the role of biology in development, gene environment interactions, or the issue of growing up outside of the biological family. Are there inherently disadvantages to that? Or questions about the complications of identity development, which are all fundamental developmental questions. And studying adoption not only contributes to our understanding of the uniqueness about adoptive, the lived experience of adoption or adoptive family life, it contributes to our theory and understanding of human development in general.
Can you give an example, David, of something that you learned through the research on adoption that is more broadly applicable?
Well, excuse me. I mean, one of the things I just mentioned, and I think Jesus will talk a little bit more about this later, is there's been a lot of research historically using adoptive families as part of the design and studying to what extent are human characteristics more likely influenced by genes or environment. And today, the way in which we study it is much more complicated than the way in which we used to study it. And many of the people who are studying this are still studying it in the context of working with adoptive families.
Jesus, do you have you'll all be shocked to hear we have some prepared questions that I'm asking, but I'm curious, separate from the questions, does anything jump out at you as, hey, we studied adoptive families, but everybody needs to know this? Is there an example of something that you come away with that you think is particularly, I guess, insightful relative to adoptive families?
I would say, that somehow goes back to what David was just mentioning. Let's talk for a few seconds about genes and about brain. We tend to think of genes as fixed, and we tend to think of brain as malleable. There is a lot of new research using adoption as a design, showing that although the genes are malleable, the expression of genes depends on the environment, the epigenetics. So genes are fixed, but the expression of genes is not. And there are no good genes or bad genes. There are environments that promote in more or less powerful way the expression of the genetic possibilities. And we tend to think of brain as malleable. However, what research using adopted children shows, and particularly the new wave of longitudinal studies in adoption, what it shows is that early adversity can set limits to the possibilities of the brain, parts of the brain, to recover after significant early adversity. However, the good news, again, coming from adoption research, is that within the brain, there are also possibilities for a better use of the brain possibilities left after the adversity. So both the study of genetic influences and the study of brain development after early adversity show the importance of the environment, the importance of the post-adoption environment to take advantage of all the possibilities, both in the genes and in the brain, to improve the lives and to improve the developmental possibilities and the of adopted people. To me, those two findings, those two new things about both genes and neuropsychology were very important. And again, both with, as David was mentioning, we are developmental psychologists. We are interested in child development and in children's and people development. And I think that the study of these fundamental issues, the importance of genes and the brain, is very significant. And adoption research has made big contributions to our knowledge on those fundamental matters.
Let me give an example of
Yeah, that's what I was
what
going
I'm
to.
talking about. You know, obviously, when we were always concerned in placing a child with what their background is. And if a child comes from a background in which there is a reasonably strong family history of something like schizophrenia, and the child is placed for adoption, there is concern, what is the risk of this child manifesting some form of significant psychopathology, whether it be schizophrenia or some other significant problem. What we now know is that although the risk is there, that when children are placed in stable, well-prepared adoptive families, the manifestation of that risk is significantly lessened than if they remained in the environment of their biological family. So that, there is a lessened risk, and the effect of the environment, the nurturing, the stability that the adoptive family offers, helps to minimize the manifestation of the significant psychopathology. It doesn't eliminate the risk, but it minimizes the risk. So that's true not just for things like schizophrenia, but for depression, for substance abuse, and so forth. And the research that uses adoption designs has shown that, and some of that goes back even before our previous review in 2010. Since then, there's been much more research using the same kind of design that has repeated this kind of pattern, showing that stability of children following, being born to a family that is at risk genetically for a significant form of, say psychopathology or medical problems, is lessened when they are placed in a nurturing home, such as an adoptive home. And that's an important takeaway for adoptive parents, because they hopefully will understand through good preparation and counseling by adoptive professionals that that just because a child is coming from an adverse background, that does not mean that adverse background will automatically manifest itself in problems. It doesn't mean that it will the risk goes away, but it certainly is lessened. So there has to be a message of hope, and preparation that go together.
So clarify one thing for us, and that is, when you're talking about the adopted child, are you talking about children who enter their family from any sort of source? I mean, infant adoptions, child welfare adoptions, inter-country adoptions. Are the lessons learned applicable to all of the above, or to what extent is there variation?
Well, let me respond, and Jesus, I think, will probably want to add. I mean, I think it applies to all forms of adoption. However, the ability to recover, is to some extent compromised, to the extent that the child is placed at later ages, because that typically is correlated with longer histories of adversity. So if a child is born into a family where there's genetic risk, they're raised in that family or live in other circumstances that are adverse, then and placed at a somewhat later age, then the ability to recover is lessened. It's not eliminated, but it is lessened, as opposed to if the child is placed for adoption very early in life, as an infant or within first year or so. Jesus, would you add any more to that?
Well, to go back to Adam's question, I think the answer is yes. We have covered, and adoption research is covering all those types of adoption that you mentioned. And I think that the fundamental findings are very similar, no matter if we are talking about, inter-country adoption or domestic or infant or child welfare adoption. So, and yes, part of it has to do with the level of adversity experienced before adoption, and again, the level of well-being that the child can find once in a new family. The message about age at adoption is important, of course, but it comes also with a big message of hope, as David was suggesting. So even when children have been exposed to significant amount of early adversity, there is still room for much improvement in their lives, in their development, and in their well-being. And of course, this takes us to another important side of the adoption picture, which is our professional interventions. What we do to help families, to help adoptees, to work with them to improve their circumstances. Because as soon as we intervene and as more efficiently we work with them, more opportunities we'll have for a better development, for a higher well-being in both in the person and in the family. So yes, I think that the key messages are very similar, no matter the type of adoption we are considering. And then there is another side to the picture, which and we need to keep this in mind always when talking about research, because very often research talks about the average child, and sometimes we forget about individual differences. So some children who are adopted very early may be more susceptible, more fragile, and even if they didn't have a significant adversity, but however, their development could be more compromised. And on the other extreme, we could have children who were adopted older, after more significant adversity, showing big potential for recovery after adoption. So that's another important message. There is no average child. There is no typical adopted child. No matter we're talking about inter-country, domestic, infant, child welfare, there is no average child. Each child is different and has a different potential and has different needs. And our job is to respond to those individual needs, although we researchers tend to focus typically on the average profiles. But I think it's important not to forget the individual characteristics of each child and each family.
Adam, I want to go back to the question about key takeaway again. Key takeaways.
Yeah, please.
I think one of the key takeaways that we try to weave throughout the book is that adoption policy and practice today, as opposed to a decade or two ago, appears to be somewhat better informed by empirical evidence than in the past. In general, but in particular areas. Particularly, I'm thinking in terms of open adoption. The research really has helped to facilitate, changes in adoption policy and practice, not only here, but in other countries as well. And in Australia, in one part of Australia, in fact, open adoption is mandatory. I forget which province it is, Jesus, but you'll tell me later. But also in areas that I've worked a lot in adoption by sexual minority adults. In our previous review in 2010, there was relatively little research compared to today on the adoption by gay and lesbian individuals. And as a result, there was still a lot of resistance. There's much less resistance today around the world, not everywhere, but around the world, in Western countries anyway, in terms of these individuals being able to adopt. So, and there's greater focus on the ethical issues in adoption and some of the malpractices that have led to the decline in intercountry adoption. That's one of the factors, is the ethical problems that are involved in that. So we try to weave some of that message in the book as well.
So you talked about the review that you guys did in 2010 of adoption research, which is often cited. I mean, it's authoritative, I think is fair to say. You just mentioned a couple of things right now, but are there other sort of new findings, new areas? Did anything pop out at you? Again, you cited a couple of things. And I will say for the group here that if anybody's interested in LGBTQ adoption, David and I edited a book on the subject some years ago. It's pretty authoritative itself. It's a tome, but if anybody's interested, that is out there. But just to jump in, so anything else, Jesus or David, that you see that really jumps out at you from that review you did in 2010 to now, 15 years later?
Sure. When we did the review in 2010, a lot of what we focused on were some of the key individual studies, the better designed individual studies. And most of those, even then, were cross-sectional studies, although some were longitudinal. But the benefit of understanding the impact of adoption on people is best understood in terms of longitudinal analysis, as well as not looking at individual studies, but at the aggregate of studies through a technique called meta-analysis. And so since then, there have been many more longitudinal studies and meta-analytic studies published. And in fact, in the section that Jesus wrote, he focuses more on the meta-analytics studies and the conclusions drawn from them, and then the longitudinal studies than any one of the probably hundreds of studies that have still been published since 2010. So part of this is about a change in the way in which we understand issues of adjustment through the designs that we employ. And Jesus has already mentioned the biological basis. Jesus, do you want to add some of the other ones that we were talking about together?
Well, I think one of the big changes since we wrote our 2010 review is that the scope of problems being studied and the depth in which these are being studied has changed a lot. I would mention just 2 or 3 contents. One is attachment. We now know much more, and I would say also more significant knowledge about attachment relationships in adopted people, in adoptive families, showing the importance not only of the attachment behaviors of parents toward children and vice versa, but also about the inner image of security, of insecurity, of emotional fragility, or the reverse, that comes with these attachment relationships. So we have learned a lot about the inner world, the inner emotional of adoptees as they develop, and the fact that we have longitudinal studies about that topic shows how they keep improving their inner emotional life when they have had a good emotional environment around them. And the other topic where the amount of research is very impressive as well is more on the cognitive side, the so-called executive function, which tells about cognitive functions such as selective attention, inhibitory control, impulse control, those things that are placed in this part of our brain and that organize our adaptation and our behavior, our relations with others. I think that these two areas, attachment and executive function, have provided a wealth of new findings from adoption research, informing human development, as David was suggesting before, and telling a lot about how to improve children's lives, how to improve their attachment development, their relationship, their emotional development, but also their cognitive and relational world.
Can you give an example of one of those learnings and how it can be used to improve more kids' lives more generally?
Sure. Let me take that, Jesus. I mean, in one section, we review a substantial amount of research that's been done on parenting interventions that help to facilitate children's development. And a lot of this work is about helping parents to facilitate attachment. Other times, others might focus on the facilitation of children's recovery from trauma. But since the 2010, there's been much more focus than previously on the capacity of parents to facilitate children's development through empirically validated techniques. And so we review some of that work and where it's been successful, and in some areas where perhaps it's not been somewhat less successful. And related to that, we also talk, at least briefly, this is the section that unfortunately got cut to some extent because of the limitations of length. We talk about the importance of parents or families, I should say, working with mental health professionals who are better trained in adoption, developing adoption clinical competence, because although most clinicians probably are well trained in general areas of clinical psychology, they don't get much training in the area of adoption. And so one of the messages, of course, is that we need better training for mental health professionals, and we hopefully can guide families when they need mental health services to individuals who have that kind of training.
Yeah, when you say they don't get much, sometimes not much equals zero. So
well, yeah, let me point out, not in this article, but in another article that I wrote for the Donaldson Institute called "The Need to Know," and it was about the need for mental health professionals to get the training. We reviewed some surveys of directors of clinical training in psychology, in marriage and family therapy, and the amount of training for individuals in graduate school was measured in most of these by most of these professionals who are responding to the survey, either in minutes or at most in hours, not in terms of number of courses, but in literally number of hours, which was very few.
Yeah, I remember it well. I headed just for folks who don't know, I headed the Donaldson Institute when David was the research director for us. So I'm going to jump real quick to a question from Rachel. Could either of you speak to what you've synthesized about fetal alcohol syndrome, fetal alcohol spectrum disorder, and the impact over time on child development and outcomes in adoptive homes.
Jesus, I think you wrote that briefly. You wrote about that.
Yes, I wrote a few pages, and then I had to reduce it to one paragraph, to one short paragraph.
What did it say, Jesus?
Well, it says one is about the incidents. So particularly for adoptions from Eastern Europe and particularly from Russia, the incidence of fetal alcohol problems is much higher. So it's something like in the general population is about 7 in 1,000. In the child welfare system is 25 in 100. In adoptions from Russia is 50 in 100.
Wow.
So it's it's a big incident. However, it doesn't mean that they are all equally affected. So some children are strongly affected, very severely affected, but many others have only some influence, some aspects are there, but it's not compromising their ability to recover from most of it. So I think we need to be very careful about making big generalizations about this, because first, it doesn't affect all. Second, it doesn't affect all to the same extent, to the same way, and it limits the possibilities of some children more clearly than in many others. So it is not the fact that the child was exposed, not only alcohol. I think that there is also a new strength of research looking at the influence of opioids when during pregnancy. So it's not only alcohol. There are other sources of negative influences on fetal development. So the incidence is significantly higher. It doesn't tell the whole story. We need to look into and also we need to look into how early the interventions started to improve the physical development and the environment for these children. So it is important, and we need to keep an eye on that. But again, the individual differences are very significant here.
Okay.
Let me add a point that I think kind of summarizes what Jesus was saying, and that is, this is less about adoption per se, but about prenatal exposure to substances, whether it be alcohol or drugs. The impact on children, as Jesus points out, is highly variable. Part of it is genetic. There are sensitivity genes that both sensitize the child to being affected, and also genes that are related to the resilience, the ability to resist, if you will, the impact. But also, one of the key principles of prenatal exposure is that it's dependent on both the dosage, if you will, and the timing of the exposure, so that the impact of exposure on brain development, and that's where usually we'll have our long-term effect to the extent that the neural system is affected. In some periods, the neural system or parts of the neural system are much more sensitive to the effects of substances, and if the substances are experienced, then the child will be more affected. If the substances are ingested at other times, perhaps the long-term effect will be much less. And of course, Jesus' last point is correct. Depends upon when interventions start as well.
Well, that's where my head goes. What are we doing about all of this? Is with all of this knowledge that we're accumulating about how it all works, how are we responding? And I think that's another conversation for another day. But not well enough is for sure. So you guys write in your book that not pathologizing adoptees, is as important as not minimizing their problems. Can you discuss that a little bit, the two of you?
Sure. I mean, in a sense, we've, I think, already at least alluded to it, if not discussed it. And that is that when you think about children, adopted children as a whole, most of them, when we look at their pattern of adjustment, are well within the normal range. If you think, for those of you who can remember the bell curve, most of them are within the normal range, within the first deviation of the distribution of scores on any measure of adjustment. But as a group, we find the adoptees more often than non-adoptees congregated at the more extreme end of the adjustment difficulty. And that's what that means is that the weight of their distribution kind of leads to a greater level of adjustment difficulties when we do our analysis. But the idea is that most are doing well, but the research tends to focus on where the problems are. And oftentimes then that's the message that gets out to the larger community, as opposed to the fact that kids are doing well, or that even kids who start off doing somewhat poorly actually show, as we've talked about already, reasonable levels of recovery. Maybe not complete, but reasonable levels of recovery.
Hey, Susan, do you want to add anything, or should I move on?
Well, I think those are the key issues that
Okay.
The fact that we don't pathologize adoption doesn't mean that we ignore the difficulties some adoptees and some adoptive families go through. So we need to be aware of those difficulties and be ready to support these people. One of the topics that I wanted to cover in more detail in the book, and in the end it was covered more briefly than what I wanted, was the research on adoption instability and adoption breakdown. Again, most adoptive families do well, but the percentage of families going through difficulties and in some cases ending in the rupture, in the breakdown of the relationship cannot be forgotten. And one of the big surprises I had when studying this was the magnitude of the difference between the problems some of the families are experiencing and the level of support they were receiving. So here we have families going through very complicated circumstances, and the professional support they receive sometimes is advice about being patient, setting limits, and showing love, which, limits and patience and love are wonderful. But this is not what these families going through serious difficulties need. They need more support. They need sometimes clinical support. And very often they need more presence, more proximity with the professionals, people who understand their difficulties, who are nearby to help them understand what's going on and how to improve their lives. So again, this is not for most adoptive families. We don't want to pathologize adoption, but we don't want and we cannot ignore the level of difficulty that some families and some individuals are going through. And in these cases, the level of support that they need cannot be as superficial as it often is. That's
Yeah,
my
that's a problem in two directions, right? There's a lack of sufficient support, certainly lack of uniformity in support, and there's also a problem because a lot of people don't want to ask for help, because that stigma, that shame applies to all parties. Everybody suffers the consequences when something like adoption or adoptees are stigmatized. And not to mention the mental health
Yeah.
it is in and of itself.
I also want to address another part of this
Yeah,
issue.
please.
Um,
David, let me interrupt for 10 seconds, then go back. This would be the time for anybody who has a question to please pop it in before we run out of time. I'm happy to devote the rest of our time to answer after David finishes to your questions, but I have a few more if you all are just in listening mode.
all I was going to say about the message about not pathologizing adoption or adoptees is that most of the major problems that adoptees manifest are not about adoption. They're about the trauma that they've experienced prior to adoption, the neglect, the abuse, the orphanage life, the disrupted attachments that they've experienced as they move from home to home within at least the U.S. Child welfare system. So it's not the adoption, although adoption brings loss, is associated with loss. We tend to think of, at least the professionals in the field tend to think of adoption loss as a normative type of challenge that most families, hopefully are prepared to address. Although if they don't address it well, of course, that can turn into a more serious problem. But we have to remember that adoption brings stability following trauma, following adversity. And it's usually the inability to help that family to deal with the child's early adversity, help the child to deal with the early adversity and traumas that lead to the more serious kinds of problems.
Great. Allison, anything in the chat? I stopped monitoring. Okay, we're good. You talked about adversity. Let's go to adjustment. You mentioned, you've said in your book, and I think you alluded to it here, that adoption adjustment is too complicated to explain with just one theory. I mean, it isn't one thing any more than the families are all the same. Can you explain what you mean? What are the complexities? Yeah, and how do you address them?
Sure. I mean, adoption is not just a complex social service practice, but it's a complex form of family life. There are obviously children are adopted in different countries that have different laws that regulate adoption, that allow for some kind of adoption or some kind of adoption practices, but not others, with different supports in different circumstances. There are child welfare adoptions, infant adoptions, international adoptions, kinship adoptions, and so forth. And no one theory is going to be able to cover all of the circumstances that represent what individuals in these different situations experience. Mark Bornstein, again, who is the editor of the series that this book is part of, published an article, I think a very important article a couple of years ago, called The Specificity Principle of Adoption. And his message is basically that to understand adoption, you have to understand when was the person adopted, what time period, from where, what was the ecological context in which the adoption took place, et cetera, et cetera, et cetera. All the specifics of the adoption in order to be able to understand what this particular child or this particular family is going through and what is likely to help them. So, whether we're people who focus on cognitive behavioral theory or psychodynamic theory or family systems theory or attachment theory, none of these theories are going to be able to capture the complexity that adoptees as a group, or frankly, any one child and their family is experiencing. And that's what we meant by that point in the book. Jesus, you want to add anything?
Actually, we don't have a unified theory about human development. So, because human development is so complex and so diverse that we need different perspectives and different, both theoretical and methodological and conceptual perspectives. So the same is true for adoption. It's too complex to be explained by one single approach. And the very good news is that we now have a more comprehensive view. Through the ecological framework, through the framework of the specificity principle David was mentioning, we now have a more thorough, a more complete understanding, but always using different perspectives, both in theories, in methods, and also in professional approaches.
So we're going to wrap it up in just a couple of minutes, but I thought just in bullet points, I'm curious to know what isn't being addressed in current research. What do you see as the needs in your world, in the scholarly world? What do we need to know more about going into the future? If each of you could just give us a quick minute.
Sure, I'll mention a few. Jesus will follow up. I mean, one, of course, is that we need more on adult development. More and more research is being done on this, but we need to understand better the transition from adolescence into adulthood, and then throughout the lifespan. My book, Being Adopted, covered that, but in a qualitative sense. You know, there is less empirical research on this. And that includes how identity is impacted throughout the lifespan, not just in the adolescent period. More on birth parents and their adjustment. More on kinship adoption. Relatively little compared to other forms of adoption. We weren't able to cover kinship adoption in our book. More on the types of services and practices and therapies that have some empirical basis that facilitate recovery. These are areas that we're beginning to see some systematic research. Well, I wouldn't call it necessarily systematic, but we're seeing some good studies done, but not necessarily studies that fully cover the areas that will help us to support these folks in raising children and in the adults as they move through their adult lifespan as well. Jesus, why don't you pick up on other points?
Well, just to emphasize the importance of a better knowledge about support, how to better support individuals and families. So we need better tools, better professional tools to identify, to get to know as soon as possible when there are problems, because we know that when there is a problem, they tend to escalate if nothing is done. So we need better professional instruments to identify problems and to address problems in an effective way. I think that that's one of the big challenges in research. It's more in the interface between theory and practice and addressing the needs of adoptees and their families.
Great. Allison, with that, I'm mindful of the clock. We are going to wrap it up. Thanks to everybody for showing up. Allison, if you want to do our official goodbye, we'll be all set.
I just want to thank everyone for being here and our wonderful guests, both David and Jesus, a wealth of knowledge, and we were just getting started. So of course, now we're going to all have to get the book so we can learn much more. And to hear that the book isn't bigger is a little disappointing to me. So maybe we'll be waiting for that second book, right? And thank all of you for being here with us, and thanks for the work you do on behalf of vulnerable children and families.